Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabetha Moreto. Our guest today is Professor Dorothy Bruck, the chair of the Sleep Health Foundation. Today, she's going to talk about her organization and the wonderful things that they do. Without further ado, welcome to the show, Dorothy. It's very nice to have you here.
Hello. It's very nice to be here.
My pleasure. So, Dorothy, please tell the audience more about yourself and the nature of your work.
Well, the Sleep Health Foundation is a non-government organisation that was set up about 8 years ago to promote quality sleep in the community and to advocate for issues around sleep health. It sort of grew out of a professional association where experts and sleep physicians and so forth got together for conferences and so forth. And we all decided we actually needed a more community-focused arm. And so we set up the Sleep Health Foundation, and it's been very successful since then. I've been there right from the beginning. I'm a sleep psychologist myself and an Emeritus Professor of Psychology. And the last year or two, I've been chair of the foundation.
That sounds wonderful. So what is your biggest current event? What's going on nowadays with the Sleep Health Foundation?
Well, in August last year, we launched a very big and important report, and that started our political advocacy campaign. And like yesterday, I just returned from Canberra. We've been to Canberra, where our federal government sits about 4 or 5 times since, over the last 12 months, really. And we're trying to get the politicians to really start and engage in a national conversation about sleep health and the importance of sleep health for our community. And one of the main reasons why we're doing this is because our report from last year, which was an independent report conducted by Deloitte's Accessing Economics, looked at the economic cost of inadequate sleep in the community. Now, inadequate sleep is when people complain that most days of the week they feel like they haven't really slept enough. And we got the experts at Deloitte to look at the economic costing, and we came up with a huge figure, or they came up with a huge figure of $66.3 billion is the annual cost of inadequate sleep to the Australian economy. Now, $27 billion is direct financial cost, so that's a huge number in itself. And then added to that is another $44 billion, which is about, they calculate it with disability-adjusted life years. So it's about well-being, quality of life. And if, for example, you've got a sleep disorder and that creates a lot of problems for you, then that well-being is what is calculated as you can't contribute to society the way you would otherwise like to or could, and that gets converted into a dollar number. So we had those big figures, much bigger than a lot of other health conditions because sleep is so ubiquitous. And a large part of that is also absenteeism and presenteeism. So absenteeism from work, I think we all know what that is, but presenteeism is when you turn up to work but you're really not firing on all cylinders. You're really not completely focused on your work. And, what we're looking at is people who turn up for work and they've had inadequate sleep perhaps over a number of nights for whatever reason, maybe a sleep disorder, maybe lifestyle, maybe their shift work roster, maybe they're competing demands. Maybe they have to hold down 2 jobs and, look after children, all sorts of things that impinge on their sleep. So we looked at those things and related that to productivity, and that's a big economic cost, the loss of productivity due to absenteeism and presenteeism.
Wow, this sounds like a very serious issue, and I can relate to that, especially with my previous job where there are times where I'm at work, but I'm really not there because I'm either sleepy or I can't concentrate on my work. So I completely understand what you just explained a while ago.
Mm-hmm. Good.
So, Dorothy, if you don't mind, can I ask you a personal question?
Yes, of course.
Why are you so passionate about helping those with sleep conditions or sleep disorders?
Well, sleep has been a very important part of my career and my study career. Even when I was doing psychology at university, there were bits of psychology that I wasn't really that interested in, some of the rats and stats sort of things, which especially in the 70s were quite prevalent in psychology courses. And one day we had a lecturer, a professor, come in and start talking about sleep and, how you measured sleep and the different stages of sleep. And I thought, wow, this is terrific. This is not only related to the real world, but there are ways that we can measure this. And once you've got a way you can measure it, there's all sorts of things that you can study about sleep. So I was really attracted to, the tangible nature of being able to investigate sleep, and also the fact that it has such consequences for individual people, and also the fact that it was so multidisciplinary. There's neurologists and neuroscientists and brain trauma people and doctors and nurses and physiotherapists and, of course, psychologists, which is what I am, and dentists even now, are all involved or can be all involved in thinking about how we can improve sleep and maximize sleep. And I found that incredibly attractive. And so I did, for my honours year, I did a study on sleep. I then went to Germany on a scholarship and studied about sleep disorders over there. Came back, did my PhD about narcolepsy, which is a disorder of excessive daytime sleepiness. And really my whole academic and research career has focused about sleep. That's what excites me, because I just think it's so interesting, and there's so much we don't know. There's so many unknown things, and yet it's so important.
Yes, that's true. I agree with you on that. Sleep is something that's very important, but unfortunately there's a lot of things that we still don't understand about it.
Exactly, and one of the things that we don't understand about it is exactly why we sleep. There's when you think about it, being essentially almost unconscious for 8 hours a night from a survival point of view is not very clever. When we were out on the savannah and we were in our caves or whatever, knocking ourselves out, being unresponsive to threats in the environment is a huge survival risk. So there must be and all animals do it, so there must be a very good reason why physiologically our bodies need to sleep. And, up till now, that's actually remained fairly elusive, what that reason actually is. We talk about, we need it to restore ourselves and to refresh and, to get the boost and recharge our batteries and all that sort of thing. And that does make a lot of sense. We go to bed tired and we wake up, ready to go, hopefully. But what does that actually mean when you look, at a systems level in the body, or what the organs are doing or what the cells are doing? What's actually going on there? And I went to a very interesting talk last year where somebody has done, a physiologist, a cellular physiologist, and he said that he believes, and he had a lot of evidence to back this up, that every cell in our body needs to sleep. I mean, that's a revolutionary idea, that every single cell in our body needs to go to sleep, and that if it doesn't, then there's a whole lot of build-up of toxins that mean that things don't work so well. I found that very exciting to hear that sort of talk. And, we think about what are the consequences of not sleeping, and we know that, some ruthless regimes around the world use sleep deprivation as a torture, and it's a very effective torture. And if you think, sleep, every single cell of our body needs to sleep, you can understand why sleep deprivation, even, 24, 36 hours, doesn't even have to be a lot. But some people just can't cope with that, even that amount of sleep deprivation. And, of course, none of us can cope with, 3-4 days of sleep deprivation. it just becomes impossible.
Wow, those are amazing facts. And that's true. Humans definitely need sleep because we're not vampires.
I think even vampires need sleep. They just sleep during the day.
Yes, that's true. They need their coffins. Unlike us, we sleep on our beds.
Yes.
Okay, Dorothy, thank you so much. I would love to chat with you more, but we're running out of time. But before we go, what advice can you give our listeners regarding sleep disorders or sleep conditions?
Well, I think it's important to prioritize sleep. And if you're worried about the quality of your sleep, I suggest going to some really excellent websites. There's our own Sleep Health Foundation website. We have over 70 fact sheets about insomnia or snoring or things, if your body rhythms are not right. So to inform yourself about, what's good and what's normal and what might be going wrong, to become a little bit of a problem solver. So there are some excellent resources around on websites like the Sleep Health Foundation one, and that can give you tips and, importantly, to let you know whether it's an issue that you need to go to your doctor about. Like, for example, heavy snoring that's ongoing, and if you've got a few, if your bed partner tells you that you're stopping to breathing, that definitely needs to be discussed with your doctor, because the consequences of having sleep apnea are very great for our cardiovascular system, even for our functioning, even perhaps for the build-up of dementia. So these things need to be checked out by a sleep test, so it's good to discuss it with your doctor if you're concerned about your breathing and your snoring during sleep.
That was fantastic advice. Thank you so much, Dorothy, for coming on the show. It was wonderful having you.
Thank you. It was my pleasure.
And that was Professor Dorothy Bruck from the Sleep Health Foundation. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and this is Health Professional Radio.